want board members to have their cameras on or off then? What?
We would like cameras to be off, please, when you're not speaking.
Okay.
Ellen and Josh, this is Julie. Debbie has sent an email that she cannot connect. She says there's a Microsoft alert about Teams that was issued yesterday that not all participants can connect to meetings. No resolution has been issued to this problem. It's a countrywide issue. Others may be able to connect, but so far I have not been able to do so. That's an email that she sent at 12:13.
Can Debbie try, can you write to her and see if she can try the call-in number?
Yes, I will do that. Thank you.
Thank you.
How are you doing? Okay. Thanks for doing all that.
For all of our guests who have logged on, this is Julie Moore with the Health Department. I provide support to the boards. Our board vice chair, who is serving as acting chair today, is having some difficulties connecting to the meeting. She's just getting ready to try joining through the phone option. So as soon as we can work our way through this technical issue, we'll be getting the meeting started.
Julie, hi, it's Debbie. I've joined on the conference bridge number.
Thank you, Debbie. Sorry about that technical issue.
It happened to me yesterday on a different Teams meeting. It's a nationwide Microsoft issue, and it's hit or miss who it affects. So the thing is, I can't see any of the participants and who's connected or not.
Sure.
I'm not
so
in the...
if you'd like me to do a quick run through, we have Amanda Cahill, a guest. We have board member Amber Sherrill, Amy Barkley, a guest. Anna Conley has joined. Carrie Nissen or Nyssen, I apologize if I've mispronounced your name. C.B. Pearson, Cindy Farr has joined. Ellen has joined. John Firehammer. Commissioner Slotnick has joined as a board member. Kathy Rogers is a guest. Lauren Wilson. Lisa Biskevich is participating as a staff member. We have a guest that is actually MCAT, so they can be live streaming. We've got Mirta from the City Council. Pam Boyd, our board member, is on. Sarah Heineman, Shannon, an individual calling by phone, and we have yourself. So let's see, we do have
I'm on. This
all
is
four
Diane
board
Sands.
members.
I'm on.
Thank you, Diane.
I'm the 2001 phone call.
Thank you.
Okay. Thanks, Julie. That's helpful for me.
You're welcome.
We go through this, and I don't know. Same thing happened to me yesterday, so I should have alerted you to that I might have problems with Teams today. But with that, we will call to order the Board of Health and get started with our agenda. First up on the agenda is election of the officers for these three boards, and I understand that Ross Miller has volunteered to remain as the chair of the board, and of course we can do that because he's not here today. And I would also volunteer to remain as vice chair, and we can look at a motion to that effect, and then have discussion on that motion.
This is Josh. I would move we maintain our current chair and vice chair.
Thank you, Josh. Any discussion on the motion on the floor from the board members? No other volunteers. This is the quiet part of the meeting. Any discussion on the motion on the floor from anyone in the public today? Okay. We'll go ahead and do a vote on the motion on the floor to maintain the current officers. All those in favor signal with aye.
Aye.
And opposed, thank you. Those opposed signal with no. Thank you. That motion will carry. Ross will be the chair and I will be the vice chair for the next year. Next up on the agenda is the COVID-19 briefing. This will be a little bit different than our past briefings by the entire incident team, and I will leave it to Ellen and Cindy to take over and invite others as needed.
Thank you. I'll just give the introduction. First, I want to thank Board Member Pam Boyd for all of her work as the testing liaison. Pam volunteered and worked quite some time and many hours helping us with the surveillance testing approach, which I think you're aware has had to be suspended for the most part because of the lab capacity restrictions across the nation, not just in Montana, but we are preserving all of her work with the hope that as things change, we will be able at some point to restart some form of surveillance testing. So thank you, Board Member Pam Boyd. Also, Rob Stenger continues to serve as the physician who reviews the protocol, signs the standing orders, and is our main consultant for all of our testing work that we do, and continues in that role. And also, it's, I think, a good time to thank board members. I've called some of you, and we've called some of you on short notice, and we're very proud of your engagement in a number of levels, and your leadership with the mask ordinance and other things that I'm sure are ahead of us yet. So thank you for that. I would call your attention, including to our viewers, to the Epidemiological Situation Unit report that was provided for the media live yesterday, but it's also been recorded, and I've sent most of you a link. Anyone in the public who hasn't gotten that link can just go to the Health Department's Facebook page from yesterday. Instead of Cindy giving a daily update, we put that on there. If you really want to understand when we're going up, when we're going down, when it means something, when it doesn't, and to understand the suite of epidemiological indicators that we use for tracking and decision making, this would be your best primer as well as your best indicator of where we are at the moment. And to steal the the unit leader's words, who is Dr. Erin Simmons, professor of epidemiology at U of M, where we are right now is in a stable position, but she cautions us that all gains are fragile. I would like you to know that I meet, and many of us meet, with very intense, good, frank, and cooperative work sessions in many ways with the University of Montana. So we're pleased to see their startup. Missoula County Public Schools, all other public school and private school districts have been meeting with us, primarily Cindy and I, weekly, and meeting with other members of our team that serve as liaison consultants to help with their startup on all levels. And then the last, I think, fun thing to say is we're putting items by invitation related to our experience here into a time capsule that will be sealed tomorrow and go into the new library to be opened in 50 years. I've never written to the future before. So that's kind of fun. And with that, I'll turn it over to Cindy, Incident Commander.
Hi, everybody. So I only have a few things to add to what Ellen already talked about, and then I would like to turn it over to Sarah in operations so she can talk about all the things that we are leaving off. So it's been a pretty busy month since the last time that we talked to y'all. We've definitely been seeing a range of cases coming in. Some days we only have 1 or 2 new cases. Some days I think we've had upwards of 15 cases come in one day. And so definitely our team has been really busy with contact tracing and contact investigation. We have really bumped up our staffing since we last spoke with you, and I'll let Sarah talk about that. But we definitely have the capacity to continue doing contact tracing and case investigation in a timely fashion at this time. We are gearing up for the possibility that we could see additional cases as, you know, all of our public schools and private schools and the University of Montana are going to be back in session. It sounds to me like from our meetings with the school superintendents that at this time, approximately 15% of students are choosing to do the online learning option or the remote learning options in the school districts. And that's kind of across all school districts. It seems to be pretty stable at 15%. And then the rest are planning on going ahead and doing the in-person learning. So we'll see how things progress as the kids go back to school. Obviously, we have some concerns moving into fall season that, you know, we know that RSV and influenza and all of those other germs that are going to be coming around, we're going to start seeing that in addition to COVID. So we're definitely gearing up for getting a little bit busier as we move into fall. We have been working very closely with many different facilities as well as businesses to make sure that everybody knows what's going to happen if they were to get a case, and that seems to be working very well. So with that, I am going to turn it over to Sarah Heineman, our operations chief.
Hi, thank you, Cindy. Let me start out with giving some quick numbers to give you the landscape of where we are with the COVID. Looking at the Montana DPHHS COVID map, and we do have a total of 6,072 confirmed cases with 1,549 active, and this is for the state of Montana. There are 89 total deaths, 101 active hospitalizations, and 117 new cases for the state as of 10 a.m. this morning. When we look at our numbers for Missoula County, we do have a cumulative total of 393 cases. That includes our 4 EpiLink cases. We are currently down to 51 active cases, which is down from 75 yesterday. So there is going to be a small time lag between the state updating their webpage from our numbers, and so we're actively working on doing that. So you'll just see that is a difference. We are reporting 340 recovered with 2 deaths. We do have over 200 active close contacts, and looks like we've got maybe 6 people hospitalized. With that said, let me start with some updates on the operations unit. So I currently have 97 employees working in operations, including myself. And I'm going to show you a organizational chart real quick, just to give you an idea, because I do feel it's a great analogy to say like an air traffic control person, because this is what operations is currently looking like at the moment. So it's pretty big. We do have the testing branch, the infectious disease branch, and the environmental health branch still. And so just to give you a little context of how things have grown since the last time we have met. So coming back here, in testing, we have moved seamlessly to our new location from the fairgrounds to Flynn Lane. We call it the warehouse. It is a drive-through testing still, and it does allow us to drive through the actual warehouse. So this helps us plan into the future for looking at weather with winter and fall coming right around the corner, that staff can be in an indoor location and we can better control the climate around them. So we're just about done moving our patient services, which are the folks that do the scheduling and the follow-up of lab results, and that move should be completed by the end of this week. And so then all of testing will be located under that one location, with the exception of our mobile van that goes out twice a week to our rural communities. We're averaging 154 tests per week. We have tested 2,931 people since we started April 4th, and we've had 28 rural mobile clinics and have tested 162 folks that live in those communities. There are 28 staff that currently work in the testing branch. We did acquire, thanks to Ellen's hard work, to get an Abbott rapid tested machine, and we're working on getting some equipment set up, and hope to start utilizing that by the first week of September. There will be a 30-day validation period, and so everyone that goes through that process gets to get swabbed twice while we are validating the process. So one sample still gets sent to the state lab as a PCR test, and the other one gets run in the rapid testing machine. Moving on to our infectious disease branch, we do have 53 staff currently working within this branch. As Cindy alluded to, we have done quite a bit of infrastructure work on building capacity within this unit so that we are able to respond, and they are certainly staying busy. In our COOP group, that is our normal infectious disease group, they are still staying busy. They're stable. They have been working through a nationwide salmonella outbreak and some other general infectious disease things that they are continuing to follow up on. In our coordination unit, our call center continues to be active at the 258 info number. Continues to answer lots of phone calls about asymptomatic testing, contact tracing, and a lot of employer questions. In our coordination group, we have 2 RNs that coordinate with different agencies throughout the community for specific needs and support, and so they're very busy meeting with those groups. And then we have a social worker who's assigned as our homeless coordination leader and works with our non-congregate shelter, and we do have that tier 3 category up and running, and we have 6 of the 8 spots filled, and our tiers 1 and 2, which are used for our quarantine and isolation locations for folks who need a place to quarantine or isolate if they've tested positive, or if there's a test pending, that they can utilize that space as a safe place. And then in our COVID group, we just definitely have been busy with all of the active cases and looking at some restructuring and building out that group so that there is definitely more capacity and there's some new leadership, and I'm just super excited about where we are with that going forward. In environmental health, we have 15 staff. This is our usual environmental health division. We do have a new staff member, Mallory, who has come on specifically as an environmental health compliance specialist to work with mask complaints within the COVID response. Since our mask ordinance went into effect July 9th, we have logged 582 COVID-related complaints. Our order interpretation and compliance group continues to be very busy answering phone calls that come in on a daily basis, and these could just be questions and looking for guidance, could be complaints, and then how the environmental health unit generally follows up with complaints and compliance issues. They follow their usual processes, and they coordinate with Ellen as our health officer, Cindy as our incident commander, and then our legal and risk attorneys as needed for more complicated cases. And that's the end of report from ops. Thanks.
Ellen, is that the end of the briefing?
I would just like to close with asking you all to do a little zoom out and make the point both to the board and the public, 2 points. The first is we are not operating in any sort of a vacuum. We get the attention, the scrutiny, and the support, and that comes with the territory, but we want you to know that the County Emergency Operations Center is absolutely integral daily, sometimes 24/7. They actually run the Sleepy Inn, and they continue to hold that post all the way through the spring flooding warnings and now the advent of wildfire season. We have our county attorney's office. We are calling on them. Just constantly. Many of the things that you read about were because people had a complaint or reporters asked for public information, and at the same time, we very, very carefully protect any link to a private individual, even unnamed. And so that has caused a great deal of work. There's a huge amount of interpretation issues between state and local and existing laws. And so I just really want to continue. And the Human Resources Office, when you staff up and down at the level, at the speed we've been doing, those are just to name a few that without that kind of support from people you often don't hear from, we would not be able to stand. So I'll end at that point. End of report.
Thank you, Ellen. I'm just going to do a voice call on the board members to see what questions you have for Sarah, Cindy, or Ellen. Amber, do you have questions on the briefing?
Yeah, thanks, Debbie. Ellen, I'm just curious if you could give us an update kind of on the finances around COVID and where we are with all of that.
Yes, we, for health department expenses, to date, we are a little bit over 1 million. We've been in operation for almost 6 months now. Some of that 1 million, I'm sorry, I cannot demarcate it for you right now, is the reassignment of existing staff we would have been paying anyhow, but certainly a lot of it is new staff, temporary staff, and that is the bulk of our costs. Our operations, even as we get into some of the testing costs we're looking at right now, really is not very large. All of that is captured both by our accountant, the county chief fiscal officer, and they are very actively working regularly and submitting, I think, requests monthly or quarterly. You may be more familiar with this because the city's doing the same, for CARES Act reimbursement. And then we get our advice and follow the guidance that comes from state DES, our local EOC, so that when we do something that we expect will be FEMA reimbursement, we do it correctly. And we have had, there are some switch ups that happen there. So for example, up until a week and a half ago, we really understood that all our testing activity would be FEMA reimbursable, and FEMA has turned from that position. But of course, testing is integral, and so those teams that I've just mentioned at the county and working with the city are continuing to identify what other funds are available. FEMA made that decision based on their decision that other federal funds that were flowing down would be available. And so they are handling all of that.
So is
Amber, additional questions?
Yeah, I was just kind of curious. So of the, Ellen, of the $1 million, do you have any sense of like where I realize you don't have a final number on this, but what amount of that million is going to be reimbursable? Are you anticipating all of it being reimbursable, or with the change in the testing, where does that leave us financially?
So FEMA only reimburses at 75%. That's their usual rule. So 25% of it would not normally be reimbursable, but that's where the CARES Act comes in, and that 25% is what is being submitted and studied and so on and so forth from that finance team, not only for the health department, but numerous, the entire county, just as the city has been hit, just as everyone else has been, with additional costs related to COVID. And so that 25% from the health department goes into the mix with all those other costs. And those get submitted under CARES.
Okay.
Now, can I tell you we're going to get it all, or when we're going to get it all? I don't think FEMA has indicated that, but I do know that some CARES money moving through that different funding stream has already been approved in some sectors.
Great, that's helpful. Thanks. Thanks. That's all I have, Debbie.
Thanks, Amber. Pam, what questions do you have?
So I was just wanting to clarify, is the machine, the Abbott machine that's going to be up in September, the one that came from the state, or is that the one that the health department was going to purchase separately?
It is the one from the state, and we should have the one that we are obtaining separately, hopefully in the next couple of weeks as well. So that will double the capacity to do that. Ellen, do you have anything to add to that?
No, thank you.
Awesome. Thanks.
Okay, Josh, do you have questions on the briefing?
Sure, thanks a lot. And I was just going to add to what Ellen said, that we at the county have received some. Our first submittal was honored by the state through the CARES Act, and we've got a second one and a third one queued up. And our conversations and relationship with Tom Livers, the budget director, has been open and ongoing, and we're actually feeling pretty good. Just to establish a kind of a platform of confidence right now in the state reimbursable, things are going well. So for questions for Ellen, I'd heard from a couple business owners about the level of anxiety and fear around COVID that has kind of become kind of a sort of an ancillary or additional problem to logistics. And I wonder if you've heard anything about this, if you could speak to it at all, because it sounds like it's quite a real thing. And I'm not looking for a solution, just if you have anything to say about that this is now another part of the landscape we're living in.
Yes, I can't speak directly to that more specific thread of concern to businesses, except I can tell you that we are receiving that message from a number of sectors, including businesses. At the same time, there is a spectrum of concerns or not concerns, all the way to, hey, I'm doing everything as safe as I can, and I'm going to go about my business. So I'm not aware of something new other than, for me, we have certainly picked up on as opening school becomes closer, things and thoughts become more relevant. So we are picking up on some of that and working closely with the schools on understanding some of those concerns and trying to address them.
Right. My other question for you was around if I remember right, there was a hood, a piece of material that was missing to get these Abbotts going. Has that been solved?
Yes, so the hood is actually being unloaded as we speak, and so facilities is out there with a forklift, and that's part of the equipment and other things that are going to be installed this week and part of next week. And so once our testing room is up and running, we will start implementing our rapid testing. So
how do you anticipate folding the rapid test machine into your general test protocol, and who would get it and why?
We are at this point prioritizing symptomatic folks, and because they're the ones that would probably be at the most risk of turning to COVID positive. And so if we can identify them faster versus someone who's asymptomatic, but might be a close contact. So we'll prioritize those folks first. And we'll continue to do the PCR testing simultaneously. And Becca Wallace, who's our testing branch director, has a great schematic plan of how she plans to incorporate that through the facility. So it'd be a seamless transition. And other than people getting swabbed twice in the beginning for us to do the validation process with the machine, folks really shouldn't notice any difference other than hopefully we'll get some results back sooner.
Great.
Ellen, anything to add to that?
No, I don't. Thank you.
Will that one hood work for both machines, or does each machine have to have its own hood?
It'll work for both. Yes.
Great. Thanks a lot. I'm all set.
Thanks, Josh. I have a few questions. Ellen, thanks for the EPI situation report. I watched it yesterday, and it was very informative and fascinating to see the ups and downs. I had a question about the frequency of that delivery, and is that a routine thing that happens once a month or once a week?
Right now, it's not routine. I think as we continue to get more data and we start to see changes, those could be changes in restrictions or activities. Or it could be changes, arrival of flu season. It could be significant changes outside of this relatively stable situation we're in right now. Certainly those would be triggers, but what we're trying to do first is introduce, usually through Cindy's daily briefing, a new statistic, a new epidemiological indicator. So she describes it, talks about it, and then it goes through one of these briefings, and then we put it on our public-facing website. We don't want to just put them all out there. But I can tell you that even though we haven't set up a regular schedule, I don't think that's at all out of the question for the EPI team to take that under consideration and try to do that.
Okay, thanks. During Sarah's report, she mentioned new staff in environmental health that's dedicated to sort of mass complaints. I just wondered if that was a temporary position or a permanent position that's been adapted to COVID.
It is a temporary position at this point.
Okay, thanks. And then, Ellen, just one more follow-up on Amber's financial questions. The FEMA reimbursement that's related to testing, is that just for sort of the cost of the test, like kits and supplies and things like that, or does that include labor and other facilities that are related to testing?
It's pretty wholesale, and the biggest cost of the testing up until what we will start to incur when we start buying some of these rapid tests that are more expensive, it's a pretty wholesale decision that they are taking testing reimbursement out of their package. But again, while I can't, it's pretty complicated, and it was pretty scary when we heard it, but I can't speak to all the parts or pieces that should be able to fill in. I believe some of it will be CARES Act.
Okay. That's all I had. And I guess, Julie, I'll leave it up to you since you're in the meeting and can see if there are anyone in the public that has questions on the briefing. We could potentially take those now.
Yes, thank you. I'm checking. For those of you who have joined via the Teams app, you do have a raise your hand icon. If you would like to use that icon to raise your hand, if you would like to ask some questions or make some comments.
Maybe it's all quiet out there. Okay, I think with that we can move on to our third item on the agenda today, which is review and possible action on scope of proposed City of Missoula ordinance entitled Restrictions on the Display of Tobacco Products and the Sale of Flavored Tobacco Products. And Lisa is here to give the presentation. There were a couple of attachments as well in the packets on this item. I guess 3 attachments. So Lisa, take it away.
Awesome. Good afternoon, everyone. My name is Lisa Piskevich. I am the Health Promotion Supervisor at the Health Promotion Division. And I'm here today to present this ordinance to you with the possible action to motion that I will give to you at the end. But I just want to direct you to the ordinance in your packet. And just to get you up to speed, in the memo that I sent out to the board 6 months ago, we started this work in conversation with the health department, city staff, city council members, and community stakeholders about the importance of providing restrictions around flavored tobacco products and prohibit the sale of all flavored tobacco products, as well as restricting the display behind the counter at the different tobacco retailer locations. And so in February, there was a Board of Health resolution that was created. And so you have that in your packet just to get that out of your, get you up to speed in the time capsule of COVID, as Ellen was referring to earlier. And so today, looking at the ordinance that we present to you from Missoula City Council, that Myrta Becerra, who is a city councilor, and I do believe she is here with us today, so we can also defer to Myrta if we have questions later on. And I just wanted to go over it briefly and let you know that within the ordinance that we have definitions around tobacco product and flavored tobacco products. We have also include it prohibits the self-service displays of tobacco products, and then also prohibits the sale of all flavored tobacco products or tobacco flavor enhancers. And then enforcement of this ordinance would come to the Missoula City County Health Department and the Environmental Health Division. And so the ordinance really matches with the Board of Health resolution that was created back in February. And so with those 2 pieces, we want to propose that the health board adopt the motion below, which is the Missoula City County Health Board supports a Missoula City ordinance that reduces youth access to tobacco products and prohibits the sale of flavored tobacco products. In support of such an ordinance, the health board submits the February 2020, there's 3 20s there, resolution to the City Council, Mayor, and County Commission, which outlines the reasons such an ordinance is necessary to protect public health and reduce youth use of tobacco products. And also, I that's the motion that will be on the floor. But I also just failed to mention that this also includes the 5 miles out of the city limits. Which is really important and critical, and that when this goes through the process with City Council of going to the public hearing, and then City Council goes to vote on it, then it will come back to the Board of Health and the County Commissioner to review and potentially approve it or not. So I'm sorry I missed that in my my overview there. So that is how this ordinance is being presented to you today. And so, Debbie, do you have questions or?
I think that the proper order would be to put a motion on the floor, and then we can have questions and discussions if one of the board members is so inclined.
Thank you for clarifying that.
Don't all jump in at once. Does anyone interested in making a motion?
Debbie, it's Amber. Are you waiting for a motion?
Yes.
I'm happy to make that motion.
Thank you. With that, I just want to first open it up to board questions or on the information that Lisa presented on the motion. I know that Mirta is with us today and was integral in the team and who helped develop the language of the ordinance. And as a reminder, the resolution that we passed on February 20th is also included, and that's what would go over to City Council, Mayor, and Commissioners for their considerations as they deliberate through this. So any questions from the board? I'll take them, I'll do it in order again, just so everyone's covered. Amber, do you have questions?
Yeah, thanks. Lisa, will you go over what you said at the end again? I got a little confused about what the process is after it
Yes.
goes.
Most definitely. I apologize.
No, that's okay. Thanks.
So the process is City Council will discuss the proposed ordinance in committee, and that's the Public Health and Safety Committee, and then recommend that the council set a public hearing. So that's the next step. And then from there, it goes to City Council to vote to approve the ordinance. And then from there, it comes back to the Health Board and County Commission to have the opportunity to review and approve it. And then that would allow the ordinance to be applied within the 5 miles. So it's got to go to public hearing or to the Public Health and Safety Committee to review. And if council is ready to set a public hearing, then you go through the public hearing process, and then it goes to City Council to vote. And I would defer to Mirta if I have that out of order in any way or not, or just to confirm.
Madam Chair, this is Mirta Becerra, and I'm happy to provide a little bit more background on the process if you would like.
Thank you. That'd be great.
Okay. So first of all, thank you so much for allowing me the opportunity to join you. And, I just wanted to say that, as you know, as you all know here, Montana, like the rest of the nation, has been experiencing an epidemic of e-cigarettes among youth. So along with other city council members and the assistance from the health department staff, as well as the community and state professionals committed to addressing this issue, I've been working on advancing this draft ordinance that you have before you. This ordinance is in response to not only the national scale health issue, but also to the resolution that you, the health board, passed and sent on to City Council, asking that we take action to prevent our community's youth. So the way I understand the process works, and I'm new at passing ordinances, so I don't have all the details from experience, but my hope is that this will be scheduled before the Public Health and Safety Committee in the next couple of weeks. After that, we set a public hearing so that we can have what I'm sure will be a robust discussion on this issue with significant public input. And my hope is that this draft ordinance can remain as intact as it currently stands, or with some improvements based on that conversation, but not scaled back to where we have to continue to amend it and revise it. After City Council takes action and votes on it, it would come back to you for your vote and your approval and action, so that the extraterritorial powers of the ordinance can be enacted. I believe that it also goes to the county commissioners, and we have presented the issue to them as well, so that they can be aware of it, knowledgeable, and supportive. So I think what we're asking today is for your expert eyes, your comments, and your support in moving this forward in that public process for City Council action. Thank you.
Thank you, Mirta. Amber, did your question get answered about the 5 mile extraterritorial limits?
Yeah, it did. That's why I was confused why it was going back and forth so many times. I think that's great. And I'm fully supportive of this. I know that, there have been a number of different cities and counties around the country that have been enacting ordinance like this. And I agree with Lisa that I think it's an epidemic in the midst of a pandemic, and all lung-related things, which is not an ideal place to be, but here we are. So I'm really happy to support any rules that are going to get us closer to protecting our youth.
Thanks, Amber. Pam, do you have questions on the ordinance or the information presented?
I don't. Thank you.
Okay, Josh, how about you?
No, I'm good. Just on a process point, I'm pretty sure it comes back to us to vote on the extraterritorial powers piece. But I remember our previous discussion, and we're in support of this.
Yeah, absolutely. For me, I'm in full support of this moving forward. I had one question. I had a preview meeting, of course, because I was coming in to chair this meeting for Ross today. And just for everyone to keep in mind, right at the beginning, actually the first whereas talks about minors and about the sale or distribution of tobacco products to minors. And that caught my eye because of the nationwide movement to exclude the sale of products to people less than 21 years of age, and how that fits in with us. And I've been educated about that we have some issues perhaps with our Constitution dealing with the difference between 21 and 18, and that will get sorted out. But just to potentially pay attention to that, because others might have questions about the difference between minors, which would be considered 18 or under, or 21 and under. But it's written very well and really thorough, excluding everything. So with that, Julie, I will let you manage this, but I think we will ask for members of the public who have questions or comments on the information presented.
Yes, thank you. This is Julie. So again, if you've joined through the Teams app, if you move your cursor around on your screen just a little, you'll see a gray bar. There's a hand icon so that you can raise your hand if you'd like to comment. And Amanda Cahill, you have raised your hand. Please go ahead.
Thank you so much. I really appreciate the chance to speak to you all here today. And we want to thank the Health Board again for the opportunity to comment on this ordinance, which will protect Missoula kids from being targeted with these candy-flavored tobacco and nicotine products. I'm with the American Heart Association, American Stroke Association here in Montana, and I do a lot of work around these policies. And so we support across the nation and really across the world now policies like this that address these candy-flavored products, including menthol, which is very popular with kids. And we know that big tobacco and vape use these products to create new users. They're bright packaging, flavors like cherry and mango and Skittle. They often place them near gum and candy aisles in convenience stores, so I'm glad to see that the part around the self-serve has remained in the policy. And just this month, we saw a study, and hopefully a lot of you have seen it, by Stanford that shows e-cigarette users are 5 to 7 times more likely to be diagnosed with COVID. And we know that kids are sharing and passing around these products at schools, and we really shouldn't be sending them back in this pandemic without addressing this immediately. So we're so glad you're taking this up, and acting now is urgent. So just urging this process within reason to move as quickly as possible, knowing we have a lot of limitations on our time these days. But thank you again. We appreciate it.
Thank you, Amanda. Julie, who's next?
We have Amy who would like to offer comments. Amy Barkley. And Amy, you probably need to unmute yourself.
Sorry about that. Can you hear me now?
Yes, thank you.
Okay, great. Thanks. I just want to comment really briefly and follow up on what Amanda said. It's very encouraging. First of all, I'm Amy Barkley with the Campaign for Tobacco-Free Kids, and like my partner there, Amanda, our organization follows and supports this issue all across the country, and we're very encouraged to see Missoula taking up this really important issue to end the sale of all flavored tobacco products, because we know those are hooking a whole new generation of kids to tobacco and nicotine, just as we were getting close to really, handling the youth smoking epidemic. E-cigarettes came along and threatened all that progress that's been made over the decades. So I did want to let you know that you all in Missoula would be in good company. There are over 100 cities across 6 states that have already taken action like this to end the sale of all products in all locations, including e-cigarettes, menthol cigarettes, and so forth. So this is not breaking new ground, but you would be kind of on the leading edge of this. And so we encourage you to, just like Amanda said, take action as quickly as possible, because this truly is an epidemic. And we don't want this to reverse, like I said, decades of progress on the issue. So please do support this. It's definitely in the best interest of public health and Missoula's kids. And we're here to support the effort in any way we can. And thank you for considering this issue. Thanks.
Thanks, Amy.
Thank you.
Next up.
Next, we have Kathy Rogers. Kathy, are you able to unmute yourself?
There. Hear me now?
Thank you. Yes.
So I'm a pediatrician, retired, and I appreciate the opportunity to speak on behalf of this important health issue. As you know, both St. Patrick's Hospital and Community Medical Center, both of their boards sent letters in support of this several months ago, and we've had a lot of discussion, and you're hearing this discussion as well. I think one of the big things that I want to bring to this is my concern about the addiction issues, which we talk to all the time, but I don't think we appreciate that addiction is not the same at different ages. And there was a study done in 2002 by Slotnick that showed that the adolescent brain is uniquely susceptible to nicotine addiction. And that's been increasingly substantiated, that as the developing brain is exposed to nicotine, it then seeks it out. So the earlier kids are exposed, the more likely they are to not only be hooked, but then to have great difficulty being able to walk away from it. The animal model studies show that during this adolescent period, it has a long-standing effect to include cell damage and immediate and persistent behavior changes. So if we look at the data, and you guys have all heard this before about how we have doubled and tripled, and we're 263% above what we were before, that Montana has the highest rate of kids using these products, and then you add flavor to that, nicotine, they're just hooked, and we have not protected them, and that's our job. So I just wanted to give you that piece of information and hope to give you a better perspective on why it's so incredibly important for us to take this into hand now. And thank you. That's all.
Thank you. This is Julie. We've got thank you. Someone had a screen share that was blocking the screen for folks. Thank you for fixing that. Next up, we have Lauren, who will like to give comments. Lauren Wilson.
Hi, everyone. My name is Lauren Wilson. I'm a pediatrician as well in Missoula, and I just wanted to thank you. I'm aware that all of you have been very supportive of this issue, and thank you for having quick action on this important ordinance to protect the health of Missoula kids. I wanted to tell you that the American Academy of Pediatrics, the Montana chapter, and the 130 pediatricians in our state who are members strongly support the effort that you're making to protect our kids from tobacco and nicotine. We know that the strategy that you're taking in restricting flavors works. There was a study actually published July 13th in the Journal of Adolescent Health that showed that the 2009 ban on flavored conventional cigarettes led to a 43% reduction in youth smoking. So we're hoping to have that effect as well on the epidemic that's emerging in Missoula and the nation at large. Thank you, and I hope that you and the City Council will give this your full support.
Thanks, Lauren. Is that it, Julie, for comments?
Yes, I believe so. If anyone else would like to make a comment, if you've got that raise hand icon, can you raise it, or can you please chime in? Looks like we do have some additional raised hands. Let me see. Carrie, I'm sorry, is your last name Nissen or Nyssen?
It's Neeson, no problem.
Neeson, thank you. Please go ahead.
I'm married into it, so, it's just one of those things. So, good afternoon. My name is Carrie Neeson, and I'm with the American Lung Association. And I really, really want to thank you for your time today and for your forward and visionary thinking in ways to protect our youth from starting down the lifelong addiction to nicotine. I think it's really unfortunate that we haven't seen more leadership at the federal level on this, but I also know that meaningful action often happens at the local level. So I really applaud your interest and your efforts in moving forward this policy. The American Lung Association strongly supports local communities taking actions like this to protect our youth from getting hooked by flavors. We know that we have a new generation of Montana youth that are exposed to these tobacco products that are highly addictive and highly appealing because of their marketing. And these products are really, really harmful. Sometimes we forget that 80% of our lung development happens after we're born. So our youth with especially vulnerable lungs are really susceptible to the chemicals and the air toxins in these products. And the tobacco industry is extremely creative, and their products continue to evolve to ensure that they'll always have new generations of kids to use their products, and that they have an avenue to nicotine addiction. So as health advocates, we also need to be creative, protective, and persistent in implementing policies to protect our youth from the lifelong addiction of nicotine. And I think restricting the sale of flavored tobacco products is a great step forward. So again, I really applaud your vision, and I hope you'll give your endorsement, and the City Council will follow your lead. Thank you so much for your time. I really appreciate it.
Thank you, Carrie.
Next, we have C.B. Pearson.
Okay, I think you can see me. My name is C.B. Pearson. I live here in Missoula. I am a campaign manager for Montana Kids versus Big Tobacco. Just want to offer up the support, and then also say that we're want to help with implementation and compliance. This is a great intervention strategy. We know the industry uses this method of flavored tobacco products. They use it with chew, with the small cigarettes. They use it with e-cigarettes. They use it with traditional cigarettes. And that's their strategy to get kids hooked. They call kids starters. It's in their own documents. They need replacement users to survive. The problem with their strategy is it burdens our society not only in the harm it does to our kids, but also in the cost it does to our society. Our health system is heavily burdened by nicotine products, and their marketing strategy is actually the reason that we have this burden. We can do this effective intervention and have an enormous impact. And as a previous speaker spoke to, the recent studies are showing that if you address flavors, you can have a significant impact. And I do believe the YRBS, I think, just came out today, and it's going to show a significant increase in the amount of youth use in flavored e-cigarettes. And we should be getting state data from 2019 in the coming weeks. So you're going to see some real significant impacts. So this intervention is warranted, and thank you everyone for all the hard work and continued conversation and the willingness to work hard to do an intervention that will protect our kids. Thank you.
Thank you, CB. Julie, do we have anyone else?
Gary and CB, you can both click your raise hand icon again to remove the icon. I do not see any additional indications unless someone wants to just identify themselves verbally.
Okay, hearing none. I looked back over my own notes and I realized that while Amber made a motion, I didn't take a second on the motion. Is there a second on the motion that Lisa presented?
Debbie, this is Julie. On Ellen's behalf, I'll just remind board members that Board of Health motions do not require seconding.
Okay, thank you. Okay, with that then we will take a voice vote on the motion on the floor, which is to support the Missoula City ordinance that reduces youth access to tobacco products. All those in favor signal with aye.
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 Okay, I vote aye as well. And those opposed signal with no. Hearing none, that motion carries. Thank you, everyone, for your participation in the discussion today on this important issue. Moving on now to our first agenda item, it's to approve the July 9th, 2020 minutes, which were presented in draft form. Is there any comments on those minutes? Hearing none, we could take a motion.
I move we accept the minutes as written. This is Pam.
Thank you, Pam. Any discussion on that motion from the board? Hearing none, any discussion on that motion from the public? Hearing none, we'll take a voice vote on that motion on the floor to accept the minutes as presented. All those in favor signal with aye.
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 Those opposed signal with no. Hearing none, that motion carries as well. Thank you. Next up on our agenda is Ellen with the director's report.
Thank you. I just want to take a minute to let you know about Health Department level of activity and return to toward more normal operations that is not COVID directly related. And I think this last action and show of leadership and mobilization in the middle of the disruption that COVID has brought to everyone is a good example and a place to start. We have in the department. I guess I'll just call them home staff, Lisa Bashevich being one of them, folks who are not assigned to incident command and are handling all the things that the people who are assigned would otherwise be handling. We, of course, have our air quality program up and running, and I'm sure you've been seeing active messages from Sarah Cofield. Our WIC program continues to operate remotely with a waiver from the state to do so. Our immunization program has switched to operating by appointment, and it is go back to school time, so we're seeing some appointments there, but we are concerned, as is the rest of the nation, about what the COVID and shutdowns appears to have done, at least on the national level, for children's immunization rates. But ours is open and open by appointment. Many of our health promotion programs are running at least part-time, if not full-time, but many of those folks are also working part-time with COVID. Arwen Wieland, for example, who is the tobacco control specialist, is just one. Our home visiting, many of our nurses who were not assigned to the grant-funded evidence-based home visiting programs such as nurse family practice, of course, were pulled early on, and many of them remain, but we've hired a number of new nurses that have now relieved some of them, but leadership positions. However, those types of home visiting services are continuing, however, with a little more creative remote approach. Environmental health is extremely involved in order interpretation, education and enforcement, and extremely because of the health officer's order and attachment A that guides those activities, and the various other governor's orders and the mask rules. However, they do have staff that continue, and again, it's been busy season for them since spring on issues related to land and development, water, the water quality district, so on and so forth. Animal control continues in order to accommodate their physical distancing for the safety of that staff. We actually had to rent a trailer, and I think that was installed earlier this week so that they can continue when they're not on patrol. So that's the status at the health department right now. End of report.
Thank you, Ellen. Do we have any public comments on items that were not on the agenda today?
This is Julie. Once again, if you have the raise your hand icon, please feel free to use it. Otherwise, since we don't have a large number of people, I think you can just voice your interest in speaking without everyone talking over the top of one another. And I don't see any indication of raised hands. Oh, here's Anna Conley.
I just want to thank Ellen and her incident command team. They've been working around the clock and they've been keeping us safe, and I appreciate all you guys are doing, so keep it up.
Well, we wouldn't be here without you, Anna. Thank you. And I think you're supposed to be off today, maybe tomorrow.
Thanks, Anna. Any other board or staff questions or comments on items that weren't on the agenda today?
This is Pam. I too just want to say you guys are doing an amazing job. I just got back from Billings where their ICU units and COVID floors are completely full, and they're building new negative pressure rooms because they have so many people coming in. And I think when we look around Missoula and see how well this has been contained, it's totally because of the efforts that you and the staff at the health department have done. So congratulations.
Thank you. We're knocking on wood and asking everyone in the community to consider that we're in a relatively low, stable, but fragile situation. And we need to stay there so that if we do get a spike, our hospitals and all of our other essential activities have room to find ways to continue the essential services they provide.
This is Lauren Wilson. I have another comment, if that's okay. I just wanted to point out that with the pediatricians in Missoula I've spoken to, a lot of us are struggling with flu vaccine this fall and physical distancing in waiting rooms because that routinely brings 50 people into the clinic in a day. I know there are talks out there and solutions that have been discussed, but I just wanted to point out that kind of on the horizon, it would be great to think of having easier access to flu vaccines, given the staffing and distancing make these offices more limited than they usually are. Thank you.
Thanks, Lauren. That's a good thing for everyone to keep in mind and start planning for those activities to carry forward the best we can. I would ditto Anna and Pam's comments and Ellen's as well. Just reminding everyone that while we have done a great job here in Missoula, just really to keep it up, and let's do all that we can for ourselves and our families and each other to keep everyone as safe as we possibly can be as we move into this next phase of things that we want to feel more normal, like school. So let's just all try to take care of ourselves and each other and do the best we can under the conditions that we've been dealt. Any other board or staff comments?
I'd just like to throw last thing out here. This is Josh. Ellen, I just want to reiterate our strong support for you and our pride in how strong you've been and your staff has been in this just unimaginably tough situation, and that you have steadfastly maintained your commitment to public health, not buckled under, I can't imagine the weight of all that pressure. And thank you for being so strong and stalwart, and continue to have our support. One thing I want to see if you might be able to check in on in the future is this kind of my question that I asked earlier, just because I've heard about this from a bunch of people now, that there's a lot of anxiety, just general anxiety. And I think it would go a long way for your office to say, yeah, that's out there. It's a real thing. It's not just you, and maybe offer some tips on how to handle it. Because it seems like from some of the business folks I spoke with, within staff groups, it's having an effect on how people interact, and that sometimes the social architecture that works so well for safety also works really well for alienation, isolation, breakdown of community, and things that we don't want to see. And if there's a way to address that, I think it's not to solve it, it's not necessarily solvable, but just to address it, I think would go a long way.
I appreciate that. Thank you. That helps me understand better your earlier comment and makes it a more actionable issue. I think just starting by acknowledging that is helpful. And then for all the stances we try to take, we also do sometimes slightly change course based on the situation, based on legal advice, based on input, but none of our stances could be taken if we didn't have a place to plant our feet. So again, let's first acknowledge it. Let's start right now by acknowledging there is anxiety, and if folks listening, or as we get into our regular incident command meetings, we actually have one called the problem solving meeting, and I don't know how to distinguish that from all the other meetings we have, but that's probably part. I know that tickled Anna, but that's where we sometimes have a moment to say, okay, what do you think of this? Who can help? What ideas do you have? What part of it is our job? Who can we partner with? And I think Josh's statements invite us as a team to do that, so thank you.
And Josh, this is Cindy. I would also be happy to address the anxiety and tips for how to deal with the anxiety living with this pandemic in my daily briefing as well.
Thank you.
Be a good place.
That'd be great.
Thanks, everyone. Great discussion. I think with that, we'll adjourn today as the Board of Health and our Water Quality District Board and Air Pollution Control Board meetings have been canceled for today. And there was a great air briefing from Sarah earlier. And if you don't get those briefings to the public, if you're interested, you can get onto the Department of Health's website and sign up as an interested party. We are still lucky this wildfire season, but we are right at the edge of a big, gigantic smoke plume that's headed our way from California. But to stay safe and healthy in your airspace as the best you can, and to watch for those changing conditions in our valley as we might be faced with an inversion with weather conditions. So just encouraging everyone to stay safe out there. And with that, I think that's it for today.
Thank you, Debbie.
Thank you, Debbie.